Hello, my name is Dr. Zara Patel, and I am a sinus and skull-base surgeon. I'd like to use this video to talk to you about nasal sprays. There are many different types of nasal sprays out there. Some you need a prescription for, and some you don't. The sprays that you need a prescription for run the gamut of things like anti-inflammatory steroid sprays. These steroid sprays have been well studied and are safe for use. People sometimes will ask me about steroid side effects because certainly taking steroids by mouth or injection, anything that you absorb systemically, is not good for you to be using steroids long term. It can give you lots of bad side effects. However, the benefit of using steroids in a topical formulation is that you get a really good dose of anti-inflammatory to the nasal and sinus lining, but you don't run that risk of absorbing it systemically. So those, if they are prescription, are very safe to use. And some of those sprays have now been around for so long that they have now gone to not needing a prescription. So you can just get them over the counter. If the spray you're using is a steroid spray, then that is generally okay for use. If you have any questions at all, you should ask your doctor. Other types of prescription nasal sprays are things like antihistamine nasal sprays, which can be very helpful for allergy patients. The main benefit, again, is that these sprays are used topically and not absorbed as much systemically as pills that are antihistamine pills. There are lots of side effects of antihistamines when you take them in pill formulation, the main ones being increased drowsiness or just a feeling of lightheadedness or fuzziness or just feeling weird. When you use the same medication in a spray, often those types of side effects can be avoided. Finally, there are prescription nasal sprays that are used to just turn down the faucet a little bit inside your nose. It decreases the mucus production for various reasons. And sometimes that is all that people need. They have a constantly runny nose. Their nose runs when they eat food. Their nose runs when they go from hot to cold environments or change pressured environments. And so for those people, these types of prescription sprays can be very helpful in just keeping their nose a little bit more dry. I encourage you to ask your doctor about any and all of those sprays.
The best head position for using a nasal spray is to have your face facing the floor with the nozzle pointing towards your eye on either side. This helps coat the nasal structures appropriately, prevents irritation of the midline septum, and also prevents most of the spray from running down your throat.
Now, let's talk a little bit about some other types of sprays that are generally not prescription sprays and just over the counter. These are nasal decongestant sprays, things like Afrin, oxymetazoline, Mucinex, lots of other brand names. But if it says nasal decongestant on it, in general, that type of spray is not good or safe for you to use long term. It's okay to use for short periods of time, for example, just 3 days or less. They're actually quite helpful for people who are having a bad nosebleed also. Again, ask your doctor about those indications. However, I would discourage you, if you have nasal congestion or obstruction, from using these sprays on a regular basis. In the short term, what this does is it constricts your blood vessels, and that's how it makes the tissue inside decongest. When you constrict blood vessels, you take those blood vessels from being able to stay at a steady state, not too constricted, not too dilated, and you constrict them over and over with this medication. The resting state of these vessels then becomes more and more and more dilated. You get what we call rebound congestion. You make yourself worse over time by using these types of sprays. So that's in general why I discourage the use of them. Take that to a more long-term type of outcome. You're constricting the blood flow to these surfaces for over a long period of time, and slowly but surely, those natural glands and structures in the nasal lining that keep your nose well humidified and comfortable over time start to slough and die off. You can end up with something called atrophic rhinitis, where your nose is very dry, very crested, and currently we really don't have a very good cure for that. So overall, keep in mind that some nasal sprays are very good and safe for you to use. Some can be very dangerous for you to use long term. And so speaking with your doctor is the best option to go over whatever the spray is that's best for you. We are here at the Stanford Department of Otolaryngology if you'd like to see us and talk over any of these issues.